Welcome to another episode of Conversations with the Co-op, where we dive into topics that matter in special education. I'm your host, Jeffrey Lee, K-12 Special Education Coordinator with the Paul Bunyan Education Cooperative. Today, we're focusing on the disability category of blind visually impaired, a topic that's vital in ensuring students receive the right tools, access, and instruction to succeed in both academic and real-world settings. Joining me today is Louise Flickinger, teacher consultant for students with visual impairments with the Co-op. Louise holds licensure in both learning disabilities and blind visually impaired education, and she brings a deep commitment to advocating for and supporting students with vision needs. Welcome to the podcast, Louise.
Well, hi, Jeff. Thanks for inviting me.
To get us started, can you help our listeners understand what it means for students to qualify under the category of blind visual impaired?
So to answer this, we have two different groups of kids. We have the birth to up to age 3. Those kids are looked at a little bit different. So if there's a concern about vision, then immediately they can put that on their plan. Of course, I look at, okay, is this whatever condition that they might have, is it known to have some vision concerns in it? So obviously they wouldn't call me unless they were thinking that there would be something like that. And then you get into the category of ages 3 all the way up to 22, and that's a little bit different. Then we actually have some pretty specific criteria for visual impairment. And there's two different parts. There's a part A and a part B. Part A requires a licensed ophthalmologist or an optometrist to provide that medical eye exam report detailing the diagnosis, vision loss, what the prognosis is. And there's different categories within that: visual acuity of 20/60 or less. The higher that number on the bottom, the lower the vision. In the better eye with the best correction. So that means if someone has glasses on, it's with the glasses on, the visual acuity has to be that low. A restricted visual field or bilateral scotomas, which are blind spots. So a restricted visual field, though, some conditions have like a tunnel vision kind of thing. That's what that's about. And it really has to be quite restricted according to the law. The third thing under the medical part is a congenital or progressive medical condition that interferes with the access to visual learning in living environments without intervention. Is the condition progressing? Is the student's academic progress affected? Congenital means born with. So, I mean, this can be like childhood glaucoma, childhood cataracts, or it could be retinitis pigmentosa. You know, there's many, many different kinds of things like that.
So help me out. If a student is like, let's say they have that congenital defect and they're in first grade and they're able to participate in their education, but we know that it's going to progressively get worse. Could they qualify that early, or does it need to actually impact that education before we would say they're?
Typically what happens is when they're older and they get diagnosed, it's already impacting them. Because they've gone to the eye doctor and said, oh, I need new glasses, or yeah, I need you to check my vision because something's up. So if they don't know it when they're born and it's acquired later, they're already going to have some problems probably. And then if glasses fix it at the time, we can also monitor it. And when it gets to the point being more problematic in the education environment, then we can get more involved depending upon the progression and what that might mean.
And that's why we have that early childhood side of it, right? Like because that probably is going to be known pretty early on,
right,
when they have that. So that lifelong type of situation is, we want to intervene early and start setting them
right
up.
There's a lot more rare kinds of things that are coming out now that they don't know until later.
Yeah.
So even by the time we're looking at age 3 and we know we have the specific criteria, sometimes we're still in the diagnosing phase. Doctors still haven't narrowed it down. Sometimes during that time, it gets a little bit harder, but then we also want a little bit more information from the eye doctor at that point.
Yeah.
And then part B is a functional evaluation of visual abilities. And in the law, it says it must be done by a teacher for students with visual impairments. So someone like me, limited ability to visually access the program and materials without modifications, which could mean alternate distances, viewing options for tasks, the need for learning materials to have large print, spacing, contrast, braille. That's one thing. So for part B, one of these items, and there's 4 different things under this too, that the child is showing a need for. The limited ability to visually access a full range without accommodating actions such as changing in body position, body movement, squinting, focal distances. So the child could need auditory or low vision strategies or devices such as slant boards, larger screens to help with body posture, magnification software, touchscreen computers to enlarge easily. That it makes it easier for the kids to do that. Help allow more normal distance to view things. Screen readers and/or braille displays to help with access to reading and different ways of doing that.
Yeah.
The third thing is a variable visual ability due to environmental factors that can't be controlled, such as contrast, weather, color, movement in the environment, lighting, contrast, time of day, that impacts the student's ability to access that visual information without an intervention. There's so many different kinds of diagnoses,
Right.
But students like with achromatopsia, they can't see any color. So the world is all
Like monochromatic.
gray. Yep, pretty much. Glaucoma, cataracts, they may be in this group of kids. Reduced or variable visual acuity due to visual fatigue, or things common to the eye condition. So extended periods of visual concentration can cause fatigue. I've got kids that even 5 minutes of extended focusing on a screen or on print, and their eyes are red and watering, and functional vision goes down. They get pretty panicked sometimes. I've got one that gets panicked because she's losing her vision. So she's like, oh my gosh, this is not good. So then she panics, but it's just one of those balancing things. So then we have to look at, do we need to do braille? And that can be that can be an answer to that. Some students have such visual impairment that the effort of just seeing or looking at things is so exhausting. I just explained some of the things that come along with that.
What I'm hearing with a lot of it is that there's very specific criteria, and we're looking at 2 different licenses, right? Like that medical license, and then having a special education teacher specifically licensed in this area, which is what makes it hard. There aren't a lot of people with that license for special education, are there?
No, and there's a shortage in that, because Minnesota doesn't actually have a program to train teachers in VI. So quite a few years ago, there was a program at the U of M. And that person who was head of that retired. So all of a sudden there was nothing.
Yeah.
And so I was part of one of the first cohorts when 7 different universities got together and decided that they really needed people. That was an interesting program, and I was one of the first people in the cohort, so we were guinea pigs. And that has gone away now too. And so now people are retiring, and there isn't a lot coming up. So Minnesota doesn't have a program here specifically in Minnesota, but they're accessing people and, suggesting that they go through other colleges in other states.
Can you tell me a little bit about what kinds of needs or challenges that this category typically addresses? I mean, you've touched on some of those with the specific criteria and stuff, but why is it so important for educators and support staff to really understand what those kind of needs are?
Well, when I think of teaching is all visual. In fact, we learn visually. 80% of things of communication are done with nonverbals. If you can't see it, then you don't have access to it. So it's really important then in a school environment where we're teaching our kids that people understand that, the things that they might be missing, simply because that's the way the world works is visual. So socially, that's a problem because someone with a visual impairment doesn't always see facial expressions, gestures, those kinds of things. Teaching is done, do this, go over there. And then we have a math problem and you have put this over here and then do this over there and over here on this map. And that child, they don't know how to say, hey, I can't see that. So teachers have to be aware of that. People who work with the kids have to know that. And the kids don't always, the kids look fine in most cases.
Personally, I'm colorblind, and I can remember in school given different things and kind of getting in trouble because, hey, take out the pink piece of paper. And I had like 2 pieces of paper there. And I didn't know which one was pink. And they thought I was just being a problem, like trying to be a know-it-all or whatever. Like, no, that's a white piece of paper. So that's a really minor version, but I can kind of empathize a little bit where there's an assumption that people who are looking at you are seeing and the same thing that you are,
right.
And that they're responding to visuals like everybody else is.
Right.
And that's where this is a really important area to recognize.
Well, and if the kids, they've never known anything different.
Right.
So until they're older, they don't even know that they're not seeing the same. So it takes a little bit for them to learn that as well.
My dad always tells a story about my uncle when he first got glasses. They were driving back home, and he was shocked that there were words on the billboards.
Yep.
And had no idea that they were there, and the family thought it was the funniest thing, but realized afterwards like how severe that was. They just didn't recognize it.
That makes me think of something, though, because I've had students who have been asked, well, can you see the board? Well, yeah, they can see the board. Then you have to ask them, but can you read what's on it?
Right.
Oh, no, I can't. Is there something on it? Or no, I can't actually read it, but I can see the board.
Right.
So it can be very literal, too. When you ask a kid, can you see it? That doesn't mean they can read it.
Right.
So sometimes that's important for the teachers and staff to know that as well.
You talked even about like high contrast stuff, right? I mean, when we had blackboards with chalk on it, there was a high contrast to that. We went to whiteboards and you write with a black marker. Maybe you can see that, pull out that green marker, and how many kids can't see
green
that?
Or red. I've got kids with low vision who say red is terrible.
Yeah.
But we think red pops.
Right.
So
well, colorblind, I don't think it pops.
Okay, some people think it pops.
Right. There can be sometimes this misconception about what it means to be visually impaired, especially since all students in this category aren't totally blind. Could you walk us through some of the common misconceptions you encounter and help clarify the range of supports and tools students might need?
Well, I can try. So one common misconception is that glasses can fix anything. And there have been students who've been told you need to go to the eye doctor to check your vision if they don't have glasses and they have maybe albinism or something. And they're saying, well, if you can't see it, you need to go to the eye doctor.
Yeah.
Or if they do have glasses, those glasses fix it. In the case of a visual impairment, that's not true. Hyperopia, which is farsightedness and nearsightedness and neurostigmatism that we know about, that can get glasses and that can fix it.
Mm-hmm.
Those things the eye doctor can tell just by the shape and size of the eye when they look at it. So they know that there's something there. But you can't fix something like the retina or an optic nerve.
Right.
We're not at a point yet where those things can be fixed. So if there's underdeveloped optic nerve, that is on top of those other things. So sometimes then just educating others about that can help.
Right. So
supports and tools for something like that. I really think that educating others to help with that. And then the student advocates later too. Another thing, the meaning of legal blindness. Sometimes people hear legally blind and they think totally blind.
Mm-hmm.
And it's so not. Legally blind has such a big range. I mean, if we think of 20/20 as perfect vision, 20 over 200 is considered legally blind. But so is 20 over 800 and 20 over 1200. They're all legally blind. If you can see anything, it's legally blind. When you're at the 20 over 200, most of the people that have that range are large print readers.
Yeah.
They don't go to Braille. It's significantly more than that before you get to Braille and to go to some of those kinds of things.
And when you're talking about like that vision, you're talking before corrective lenses, right?
Yes.
And I think
Good
that's
point.
that's a really common misconception for people too. When you're talking about the glasses, is there are certain things we can correct, but the disability itself, when we're categorized that, are saying with the corrective lenses, this is what they're seeing.
Yes, and I explained that to someone, a couple months ago, and I said, okay, when I take my glasses off, I am visually impaired, and I'm probably legally blind. But when I put my glasses on, I'm not visually impaired anymore. And they said, what? And I said, because it's corrected then.
Right.
So with my glasses on, I am not visually impaired anymore. But I have to have my glasses on to do that.
Right.
So yes, it goes back to that whole glasses and does it fix everything and all of that.
I think it's important too to think like with our other disabilities and it affecting your ability to access education. If I put my glasses on, I can access my education. I don't really have that visual impairment anymore. I don't have a need for an IEP because of my glasses.
Right.
But if I put my glasses on and it only improves things 10% and I still can't access it, that's a different story.
Right. Yeah, when I put my glasses on, I can actually see the board and read it. Without my glasses on, I can't.
Right.
And so that's hard for people to understand that part sometimes. There's a misconception too that a person who's visually impaired isn't able to function independently too. Especially when the kids get older and now we have young adults and they're looking at jobs and that kind of stuff. Employers struggle with this since the person may need to utilize different equipment or strategies. They worry about safety and liability. The supports to help with that, State Services for the Blind work with people who are visually impaired to help them get competitive employment, to help employers understand that. It's still it's just hard for some people to even think that someone who's blind can actually be that independent person. And they worry about them, but they really can do a lot.
And that's one of our jobs as educators in education as a whole is to create independence and teaching skills. So you have this impairment, but this is something you can do to be more independent or to compensate, or sometimes just that advocacy, like this is what I need.
Yes.
Don't worry about me. As long as I can do this,
yes,
I can do this job just fine.
Yes. And it's hard to have others sometimes understand that and believe it. That is one of the barriers that we do see too. There is that thinking that, okay, this goes along with it, that the person looks like they can see just fine because they walk and talk and navigate. But the kids adapt so well. And so even if they see just light, but they don't see much else besides light, they navigate pretty well. Some people really do well. Yeah. Educating others in self-advocacy are important for this as well. I think I would come back to that over and over and over. And collaboration with teachers, with staff, with family to ensure access. Another thing that I think about when we talk about misconceptions, the things that I run into, I have some kids that I work with who are Braille readers. And they need that tactile and Braille reading and writing. And we do so much digitally now. So digital curriculum, though, isn't always accessible. And sometimes people think that if it's digital, it's accessible. What do we mean by accessible, right? Because accessible to one person is different than accessible to another.
Correct.
So the publishers of online materials aren't necessarily required to make sure that a device can work with it.
Right.
Then it's all trial and error. And so when I tell teachers that, sometimes they're like, what? Well, what about Google? What about, what about this and what about that? And I don't want to name anything specific, but.
Well, and I think it gets confusing for teachers sometimes because we think of UDL as something that is helpful to a lot of students, but that doesn't always mean, just because it's UDL, doesn't mean that it is helping somebody access it, right? Like that's more of a general, this is helpful for lots of students.
Right.
But this individual might still not be able to.
And someone with low vision, if they have the right computer, they could probably access that really great. But the more severe the vision is, then you need those tactile things. Then it's a little bit harder. And then the only way we know is trial and error. So, and that's really hard for teachers to hear that. And that's what we really do. Our job is really looking at what the program is that is in place, and then how are we going to help that student access what you're trying to teach. And sometimes it's just really hard to know where to go with it. Auditory isn't for everyone. Auditory doesn't explain things either without telling them the answer to a chart in a math problem.
Right.
So then how do you show that in a different way? Because we want the kids also to be with their peers in the regular ed classroom doing the same work at the same time. And that is what our goal always is.
Right.
To the extent that we can for the ability level of the student.
So for teachers and case managers and related service providers, what are some practical strategies and considerations that can help them better support students with visual impairments? What should teams really be thinking about when it comes to things like materials or classroom access or even transition planning?
My first thought when I think this is one size does not fit all. Vision impairment conditions are so varied, relating to available vision, ability level, time needed to complete a visual task, all of those things. I'd say consider information from that functional vision assessment. And I don't think that I would want to say, these are the strategies you use across the board. I think if there's a visual impairment that has been determined through special ed criteria, that you need to have that information about that functional piece. What works for this student, what might not. So I think we have to always go back to that too. Standardized tests don't usually include students with visual impairments, so keep that in mind in benchmarks and norms. And also the timing and the visual parts of that may not be applicable for that kid or appropriate for that child. So you might need some different measures, especially if you're doing some ability grouping with that information.
Right.
Kids don't always like to have their disability pointed out, but sometimes we just need to ask them, can you see it? But make sure you don't say just you see the board.
Yeah.
Right. Describe more. So as you're writing, make sure you're describing more and try not to say that go there, go do this and do that, because they may not have a clue what you're talking about, and they're not going to let you know that because they're so used to not knowing so often what people are talking about.
Right.
So, so those some practical considerations. And then I think collaboration is important. That's something just to always keep in mind. You're not in it alone. Sometimes classroom teachers get really worried because they want to do the right thing. But, you're not alone with it. So there's help. We are all in this together.
And I think it's important for people to remember that this is so specialized that we have its own special license, its own special criteria. There's just no way for everyone to know everything about everything.
Right.
And so you aren't alone in this. That is why we have individuals licensed like yourself in this disability category so that they have that knowledge and experience to be able to help you out, and that you don't have to just try to solve all these problems by yourself.
Right.
Louise, one of the things that you're known for is your strong advocacy on behalf of students with visual needs. What are some of the biggest barriers these students face in the school system, and how can we as educators and teams ensure that we're not just including them, but truly empowering them?
So the biggest barrier with visual impairments is access. Access to the curriculum, to the social cues that are out there in our communication systems in the first place, environments with people, signage, activities going on that may be missed or misinterpreted. So we as educators and teams can work together to learn about the student and that vision impairment and what's needed to make the student successful in the classroom, as well as preparing them for the future, like we talked about, helping them to know what tools are out there to do some of the tasks that they're going to need to be successful when they get out after graduation. So this can mean describing more as you teach, writing larger with contrasting color, screen sharing, those kinds of things. Another barrier is, because the biggest barrier is always access. In my opinion, it's always that access, because you miss so much when so much is done visually. But how others view the disability is also a barrier. I hear that from students who are now, are married and have their own kids, or are in college right now. Just even the social opportunities and what other people expect out of them, not understanding that that person may not, they maybe aren't comfortable in that setting.
Yeah.
And sometimes employers have a difficult time allowing the person to show them they can do things. That is a barrier. That's the reality of the situation. There are some barriers simply because you can't see.
And I think some of those happen because the individuals without the visual disability are not comfortable because they haven't been exposed. It's not a very large population in our disability, right? So when you come to a student who has this category, you've maybe never worked with a student like that before. And so it can be a little unsettling just from the lack of knowledge piece of it. But that, again, going back to, we're not alone in this, right? Let's talk about this. And depending on the age of the student, having them help you, because you want them to be independent and advocate for themselves. So not being afraid to ask them some questions with the intention of, how can I help you gain that access?
In most cases, it's a panic situation at first. And then when the student is in their class and they get the supports that they need, they realize, teachers have come back and said, that was the best experience I've ever had. It's not as easy to get around that barrier out after school, because then an employer has to be okay with things. It's a little bit different. It's just the person has to be able to try to work through those barriers.
Louise, thank you so much for sharing your perspective and expertise on supporting students with visual impairments. It's clear that when we focus on accessibility, individualized supports, and active advocacy, we can ensure that these students thrive academically and beyond. Thank you for joining me today.
Well, thanks, Jeff. It was nice talking to you.
It's good talking to you too. To our listeners, thank you for tuning in to another episode of Conversations with the Co-op. Tune in for future episodes where we continue to challenge assumptions and provide resources to help all students thrive. Until next time.